Hello, everybody. This is Gary. Today is Tuesday, March 14th, 2023. It is 4:13 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today, I'm not doing so bad. My paranoia doesn't seem to be that bad. My delusions don't seem to be that severe. My auditory hallucinations are at a bare minimum. My anxiety levels are pretty high for some reason, but my depression is not too severe. Tomorrow I have an appointment with my psychotherapist. Next week I have an appointment with my peer support specialist, who is a person with a mental health diagnosis who works as a counselor on staff at the clinic I go to. I'll be seeing her next week. I'll be seeing my psychiatrist either in the last week of March or the first week of April. I did go out for my physical therapy exercise walk today. I went to the pharmacy and picked up one of my blood pressure prescriptions. The weather's kind of cold and snowy outside today in Rochester. It's winter. It's the middle of March. The winter weather always makes my mood and my paranoia, my anxiety, my delusions, and my auditory hallucinations on average more intense. It also increases my physical pain through arthritis and the pain that I feel in my right knee from the surgery I had last year. I had torn a meniscus in my right knee and they had to repair it through surgery. It's still kind of painful, and the pain gets worse during the winter, and so does my general arthritis pain. I take an antidepressant called Cymbalta for physical pain. I take Neurontin for physical pain, Motrin, Tylenol, and Flexeril for muscle and back pain. I'm not taking any opioids for pain. My day today is going okay. Like I said, I have high levels of anxiety, but not much else is going on as far as my psychiatric symptoms. I'm doing better today than I was a few days ago. My overall anxiety levels are higher, but the rest of my psychiatric symptoms don't seem to be that bad. I still have an appointment on March 28th with a pulmonary specialist because I have pulmonary fibrosis, which is scar tissue is forming in my lungs. It's not cancer, and it's not emphysema, but I have scar tissue developing in the air sacs of my lungs, which makes it more difficult for me to breathe, especially when I'm walking or exercising. I get very much out of breath. When I go see the pulmonary specialist, they will have me breathe into a machine to test the strength of my lungs, and then I will talk to the pulmonary specialist after that to see where we go from here, because right now I don't know what's going on with my pulmonary fibrosis, how severe it is. I just don't know yet. I don't think it was caused by cigarette smoking. I quit smoking 14 months ago, and the pulmonary fibrosis didn't show up on a CT scan last year, but it did this year. So it developed between last time I had a CT scan and the new CT scan I had. They may do another CT scan partly as a lung cancer screening, but also to check for the pulmonary fibrosis and see how severe it's spread through my lungs, if at all. The only thing I could think of that would cause pulmonary fibrosis is I cleaned my apartment a lot with bleach, and I was breathing in the vapors, accidentally, of course, and it damaged my lungs. That's the only thing I can think of. I don't think it's from cigarette smoking. Like I said, I haven't had a cigarette in 15 months, although I am still using nicotine lozenges. There's not much else to report on. My day's going okay. Could be worse. Same old shit every day. Like, comment, share, subscribe.